You know exactly the reality.
Yes.
And Brazil already did a good job. I mean,
We
living,
try.
living, living in US, what will be your message to the? Unfortunately, tonight one of the big minister of Argentina will come to
To the
the
meeting.
open ceremony.
Oh, great.
You will be not there, but maybe we can send an image. What will be the effort that we, like Latin America, has to put on from the political point of view on strokes?
So I actually think this is the most important question that was asked to me. So when you look at stroke globally, it ranges between number one and number two cause of death in the planet, and it's specifically a high cause of death in Latin America. And the other problem that you have in our society is when somebody has a stroke, we actually take two people out of the workforce, right? Because the stroke patient can't work anymore and they need one family member to be a caregiver. So many people stop working to care for the loved one. So I think it's very important that our politicians start paying more attention to stroke and invest in stroke. Right now, we have intravenous CPA paid by the government, the public healthcare system in many of the Latin American countries, but no countries is in a large scale paying for the thrombectomy procedure, which has, if anything, a larger treatment effect than TPA, and has a higher impact in the bigger strokes that cause the higher rate of disability and death. So I think it's extremely important that we advocate at the level of our politicians to make them understand that they need to invest in education of the population, but also in organizing the structure to have this treatment available at a large scale throughout Latin America.
I think this is very important. And the very, very last question. You already give your message for those young neurologists and interventional neurologists who are there. We had, since 10 years now, a very nice and very high volume center in Buenos Aires. What would be your message today with the knowledge that you already have for those young guys, which are absolutely different than
I fully agree. So I'm very familiar with your center. You actually had a mobile stroke unit before many of the US sites. So for the people who have everything, I think you need to understand that stroke now has two time windows. You have the early window where you really need to remember time is brain. But we know that within that first 6 to 8 hours, the vast majority of people, you have good imaging. And a lot of them are what you call fast progressors. The stroke grows very fast. So in order to optimize benefit in that early window, you should be minimalist. Essentially, if you can take the patient straight to angio and just do minimal imaging there, that's very reasonable. A lot of work has been done in that area, and I think that's actually going to be the future. But no, doing simple imaging, non-contrast CT, a CTA, if you have one of these GE Revolution scanners that will do a full brain perfusion very quickly, it's reasonable to acquire the image, but you shouldn't use it to exclude patients from treatment in the early window because you have a lot of false positive cores with CT perfusion and you end up hurting patients. So I think even in the very sophisticated centers, time is brain in the early window, minimalist approach, treat as fast as you can. However, in the late window, the patients that will have a benefit are no longer the fast progressors. Those who already have the big strokes, and the patients that will benefit, they progress slower. So you do have a little more time to actually do more refined imaging with CT perfusion or even MRI. But again, it's very important to understand that even in that population, time is brain. So you need to follow your time metrics and try to treat the patient as soon as possible. But I think in the later window, mismatch is brain looking for a mismatch makes perfect sense.
Thank you very much.
My pleasure.